For the next two questions, Greg, I'm going to say this to you. You kind of got a little ahead of me here. In the fact that these are two subjects that I have planned in making videos on. So I'm going to answer your questions, but my more in-depth explanations will still go into the individual videos I make on these subjects, so to speak. Question 11 is, what do you want the government to do for our veterans without the program sounding like a social program? Unfortunately, the current VA program already sounds a lot like a social program. But as a veteran myself, a compensated veteran, I have 30% disability through the VA, and I have utilized VA facilities. What do I want the government to do for our veterans? We obviously need to fix the problems of the VA. Now, I have a couple different plans that need to be researched as to which will work out better. One of them, some of the ideas that I have is like here where I live at in the Adams, Pike, Scioto County area. Portsmouth has a VA outpatient clinic, but the closest VA hospitals, you have three. You have one in Cincinnati, one in Chillicothe, and one in Huntington, West Virginia. The VA outpatient clinic in Portsmouth is affiliated with the clinic or the hospital in Chillicothe. The problem is all three of those facilities are an hour and a half from this area. Okay, specifically the Adams, Scioto County areas. Pike County is a lot closer to Chillicothe, so it's not that far out of range. One of the things that I think we need to look at to solve the VA healthcare issues is offering the veterans who live outside of a certain range of a VA hospital the ability to go ahead and use their healthcare providers, their local healthcare providers, their local medical facilities, and it's covered by the VA instead. It would prevent these people from having to drive an hour and a half away to get medical care when they could go right there where they're normally going at. You already have a healthcare provider. You've already got medical coverage right in that area. You've already been utilizing them for other things. Why not go ahead and be able to utilize that covered for by the VA right there where you're already at? In that aspect, part of that solution could be a health insurance program sponsored through the VA, where the Veterans Administration gets with a health care company to provide health insurance for veterans. Now, there already is a system like that. It's called TRICARE for the retirees. Maybe we could expand that TRICARE to all veterans. You still have a monthly premium that you pay. I need to research. I've been meaning to for a long time, and I really do need to sit down and research exactly how TRICARE works. I think it's under a percentage basis where it pays 80%, you pay 20%. I know that's how the system called Champus works. When I was on active duty, you have a system called Champus. When I was on active duty and I was married, if I came home on leave for something, and I came home on leave, and let's say I was out working on a farm helping my dad or whatever, and I got injured, and I went to the hospital, or I got sick, and I went to the hospital, 100% of my medical's covered. It's all paid for by the military because I'm active duty. Now, if my wife or my child was to get sick or injured and went to the hospital, they're covered under Champus, not full service as an active duty member. Even though I'm active duty, they're covered under Champus, which means Champus pays 80% of their medical bills, and we're still responsible for the other 20%. When I got divorced, My daughter was still a dependent, and so she was covered under Champus for the rest of her life, or for the rest of the time I was on active duty. As long as they lived outside of a 50-mile range of a military installation. Okay. If they lived within 50 miles of a military installation, then they would be required to go onto military base, active military base. They would be authorized to use the facilities on that military base, and it would be covered by the government. So, having a system like that, maybe expanding TRICARE to the veterans, all veterans, is a possibility. See, these are financial things that we got to look at with the VA, which is a part of the budget plan in the restructuring of the government. And I might actually be getting into the next question a little bit here too. Another thing that I think would help with the veterans' healthcare system, we're talking about using local facilities. It never hit me until I was in Columbus, Georgia, working in Columbus, Georgia, which is Columbus, Georgia. Phoenix City is the metropolitan area, right outside of Fort Benning. Fort Benning is the second largest military installation in the United States, and there is no VA medical facilities in Columbus, Georgia. There's a VA outpatient clinic like here in Portsmouth, and it's affiliated with the VA hospital in Tuskegee, Alabama, which is an hour away. Now think about this. You have the second largest military installation in the country. How many veterans and retirees do you have living in that area? Okay? And you have no VA facilities for them there. They have to drive an hour away to go to the closest facility. That is ridiculous, in my opinion. And after I realized that, I started thinking about it. Camp Lejeune is the same way. Jacksonville, North Carolina does not have a VA hospital. The closest VA facility is in Fayetteville, North Carolina, Fort Bragg, over an hour away from Jacksonville. Jacksonville is the largest Marine base on the East Coast. So again, think of the number of veterans and retirees living right out there in Jacksonville and the surrounding area. So what would be the best option for them? Well, open up the base facilities. Veterans, if they live outside in the town around a military installation, then why can't they just go on base and use the base facilities for their medical care? I was talking to a veteran about this about a month or so ago, and he says, well, they don't do that. I know they don't do that. The question is, why can't we do that? So those are some of the ideas that I want to research as to cost effectiveness and the ability to increase the care of our veterans by implementing those situations. And implementing any of those situations is also going to improve care at the VA facilities, because part of the problem with these VA facilities is they're so overwhelmed with the number of people trying to get in and get looked at. When you offer other options, you reduce the workload on these facilities, and therefore it's going to make it easier for people that utilize them to get cared for. So those are ideas. Those are things that I'd like to look into. How exactly can we do it? I don't have any way of giving a definitive answer for that right now, because those are things that we need to research as to the cost effectiveness. Maybe there might be some way, well, I already said, like with TriNet, that we could just, when you separate from the service, whether it's 2 years, 4 years, or 30 years, that there's a medical insurance that you can sign up for. And obviously it would be a discounted rate because it'd be a huge group insurance program. But it would be one equal amongst all the veterans. And then you would be able to use your local healthcare provider where you lived at, and that insurance would be paid for by the VA. There's several different programs there, and those are the things I'd like to research. And whichever one is the best, provides the best care for the veterans with the obviously least expense on the government. We can't go overboard on government expense in trying to do this. We're trying to balance the budget and start paying off the national debt. We can't get into a system that creates $1 trillion a year burden on the budget in order to pay for that, because we don't have the money to do it. As much as I would love to, have free health care for all veterans, period, where a veteran could use any facility in the country and they don't have to pay a penny. Unfortunately, we can't afford that. It's just not physically feasible. So what we need to do is balance it between the ability to pay for it and how we can increase the veterans' health care.